The following special treatment guidelines apply to treatment with manual lymph drainage and differ from the principles of classic massage. Your therapist will tell you how much pressure to use, but you generally use enough pressure to avoid sliding the hand on your skin. You should not feel any pain during the manual lymph drainage. There should be no reddening of the skin. Do not use lubricants such as lotions or oils. All of the following manual lymph drainage should be done on your bare skin. Repeat the strokes 15 times, one stroke every 2 seconds. Step 1. Neck. Perform this on the affected side first, and then the unaffected side. Place the index and middle finger of the unaffected hand together and position them in the hollow space close to your neck. Stretch the skin forward and curve your fingers inward to the middle of the neck and release the pressure. Repeat 15 times. If you choose, you may stretch both sides of your neck at the same time. Step 2. Armpit. Place your unaffected hand in the affected armpit. Stretch the skin forward and curve your hand upward toward the neck area. Release the pressure and repeat 15 times. Step 3. Chest. Perform this on the affected side only. Place your unaffected hand on the chest wall, just below the ribs on the affected side. Stretch the skin upward toward the armpit area and release the pressure. Stroke 5 times in 3 lines. Step 4. Lower abdomen. Perform this on the affected side only. Place your hand above the affected groin area. Stretch the skin upward and release the pressure. Stroke 5 times in 3 lines. Step 5. Deep breathing. Place hands on either side of the lower rib cage area. Take a deep breath, letting your belly and lower ribs expand. Hold the breath for 1 to 2 seconds. Breathe out, pressing your hands up and in to help push out the air. Repeat 3 to 5 times only. Perform all of the following techniques on the affected side only. Step 6. Thigh. Place either or both hands on the inside of the affected thigh. Stretch and release the skin up and out from the inside to the outside of the thigh. Stroke 5 times in 3 lines, making sure you cover the whole area. Step 7. Knee. Place the palms of your hands on both sides of the lower portion of the knee. Stretch the skin up toward the hip and waist area. Stroke 5 times in 3 sets. Step 8. Behind the knee. Place both hands behind the knee. Stretch the skin up towards the thigh. Stroke 15 times. Step 9. Calf. Wrap your hands around the top of your calf with the thumbs on the front and the fingers behind. Stretch the skin up toward the knee. Stroke 5 times. Move your hands lower on the calf. Stretch the skin up toward the knee. Stroke 5 times. Move your hands above the ankle area. Stretch the skin up toward the knee. Stroke 5 times. Step 10. Heel cord. Place your ankle on the opposite knee if you can. Place your fingers on both sides of your heel cord or Achilles tendon. Stretch the skin up toward the back of the calf. Stroke 15 times. Step 11. Foot. Place your hand on top of the foot. Stretch the skin up toward the ankle. Stroke 5 times in 3 sets. Step 12. Toes. Stroke up each individual toe toward the ankle. Begin at the toenail and continue toward the web spaces. Repeat 15 times for each toe. Step 13. Repeat everything from step 11 to 1. Step 14. Back. Perform this in standing. Using a long-handled bath sponge, stroke the skin along the back of the affected hip up toward the armpit area. Repeat 15 times. If you have any questions, please contact your therapist.